Well, I spent my afternoon investigating the COVID-19 numbers, both in Ohio and around Youngstown. In some cases, they are falling, while in others, they are not.
Let's start with new cases in Ohio, which are trending down. 4 weeks ago, there were over 3,000. The week ending today had 1,300, a drop of 57%. The percentage of new deaths in Ohio has fallen even further. 4 weeks ago, 228 people died. Last week, there were 57 new deaths in Ohio, a drop of 75%. The one category that spiked was new hospitalizations in Ohio. For 3 weeks, it was falling, but then in the past week, it rose to 784, almost 3 times more than the week before. Locally, in Mahoning County, the number of deaths spiked last week as well. It was steady from 14 to 10 for a while, but last week rose to 22. New cases in Mahoning County also up last week. It had been falling, holding steady at 69 for 2 weeks, then in the past week jumped to 76. New hospitalizations in Mahoning County, however, have dropped and have stayed low, going from 22 to 14 to 9 and 10. Now to Trumbull County, where new cases were up last week, not to the point where it was 4 weeks ago, but still 27% higher than the week before. New hospitalizations in Trumbull County have not been high for the past 4 weeks. It was 9 a few weeks ago. This past week, there were only 3. The number of people dying in Trumbull County also very low, just 15 deaths in the past 4 weeks. Columbiana County does not release hospitalizations, so we have only cases and deaths. Those first 2 weeks of cases were high because of the mass testing at the federal prison in Elkton. 2 weeks ago, there were only 6 new cases, but last week rose to 25. And COVID-19 related deaths in Columbiana County, only 9 total in the past 4 weeks.
One last note about Columbiana County: 65% of all of its cases and 71% of all of its deaths were either from the federal prison in Elkton or at long-term care facilities. Take away those numbers, and Columbiana County drops from 11th in Ohio for most cases all the way down to 29th.